Lung cancer. Lung cancer. Some of the signs and symptoms of lung cancer are shortness of breath, a persistent cough, with or without blood, chest pain, and a lot of chest infections. Lung cancer can be treated in many ways, such as through surgery, radiation therapy, chemotherapy, and special drugs. How lung cancer is likely to turn out depends on its type, its stage, and how well it responds to treatment. Lung cancer is the fifth most common type of cancer in Australia, and it tends to spread quickly. Most of the time, there are two main types of lung cancer. About 85% of lung cancers or non-small cell lung cancer. The last 15% of lung cancers are called small cell lung cancer. Small cell lung cancer usually begins in the middle of the lungs and spreads more quickly than non-small cell lung cancer. How do you know if you have lung cancer? Some of the most common signs of lung cancer are, even if you have some of these signs, it doesn't mean you have lung cancer. But if you have any of these symptoms for more than 2 weeks, you should talk to your doctor about them. Most cancers are caused by changes, mutations, in the genes of cells in your body. There are many things that can make you more likely to get cancer. Some of them are older age. If you've lived longer, your body's cells may have changed more, making you more likely to get cancer than younger people. Smoking. Smoking hurts the cells in your lungs and makes it more likely that they will change. Lung cancer is more likely to happen if you smoke. Passive smoking, which means being around people who smoke, also raises your risk of getting lung cancer. If someone in your family had lung cancer, you may be more likely to get lung cancer yourself. Exposure to certain things. Long-term exposure to things like asbestos, radon, and some heavy metals may make you more likely to get lung cancer. Especially if you have any of the above symptoms, you should see your doctor right away if you have new ones that worry you. This is especially important if you have a history of lung disease, a family history of lung cancer, or you smoke. Several tests and scans are used to find out if someone has lung cancer. When you go to the doctor, he or she may ask you about your general health, as well as your medical history and that of your family. It is usually done in one day under sedation or a light general anesthetic by a specialist doctor. After the procedure, you might have a sore throat or cough up some blood, but most people get better quickly. Biopsies of lung cells can be taken during a bronchoscopy to look for signs of cancer. If your doctor doesn't suggest a bronchoscopy, you may have to go through surgery to get a biopsy. If you are nervous about this procedure, you might want to talk to your doctor about it. To look for cancer cells, you may also be asked to give a sample of your sputum, phlegm, or to have fluid drained from around your lungs. If you have lung cancer, your tests and scans will give your medical team important information about your cancer and help them figure out the best way to treat it. There are different ways that doctors can treat lung cancer. The type of treatment your medical team suggests will depend on many things, such as the type of cancer you have, its stage, your overall health, and the goal of treatment. The best treatment will also depend on whether the cancer started in your lung, primary, or spread from another part of your body. Metastasis. When cancer spreads to the lungs, a metastasis, the treatment usually depends on where the cancer started. Cancer treatments can include cutting out the cancer, which can be done with a lobectomy, a pneumonectomy, or a wedge resection. A lobectomy removes one lobe of a lung, a pneumonectomy removes a whole lung, and a wedge resection removes only part of a lung. Radiotherapy hurts cancer cells and stops them from dividing or spreading. Chemotherapy uses strong drugs to kill cancer cells. Targeted therapy uses drugs that attack specific parts of a cancer, like certain genetic mutations. Immunotherapy helps your immune system recognize and kill cancer cells. Depending on your situation, your healthcare team may suggest one or more of these treatments. The outlook for lung cancer depends on how far along it was when it was found, its stage, how well it was treated, and how healthy the person was in general. Together, you and your medical team can make a plan for how to treat your cancer. This plan will include the goals of your treatment and the steps that will be taken to reach these goals. You can lower your chance of getting lung cancer if you don't do things like smoke or work with asbestos. Some risk factors, like getting older or having a history of lung cancer in your family, can't be changed. Because lung cancer affects how the lungs work, some people with it will have symptoms like shortness of breath, a cough, and/or chest pain. Lung cancer can also make you less hungry, which can cause you to lose weight. You may also feel these and other symptoms as a side effect of the treatments for lung cancer. Your medical team has a lot of experience treating lung cancer symptoms and complications. They can help you deal with them by giving you advice and support. Even if you are getting treatment for cancer, the disease could still spread to another part of your body. Metastasis. If this happens, you and your healthcare team may need to change how you